Good evening, everyone. My name is Vito Borello. I'm the Executive Director of the National Association for Family, School, and Community Engagement. Welcome. Before we begin today, we'd like to encourage you to participate in a poll as we're interested in understanding your current perspectives around vaccinating children. We won't be sharing this information tonight, but it will help us to understand our audience. And we'll give you, the next 20 to 30 seconds to do that, and then we'll begin. Thank you. And Alice, I still see that people are coming in, so let's give people another couple minutes before we begin, or at least a minute. Okay, for those of you who have maybe just came in the last 30 seconds or so, we're asking everyone to start, if they could, by filling out completing our poll around vaccinating children. And we're going to use that information just to better understand our audience. With that, I'd like to begin this town hall meeting this evening. Again, my name is Vito Borello. I'm the Executive Director of the National Association for Family, School, and Community Engagement. And I'd like to start by thanking all of our partners at NAFSCI, which is our acronym, who were able to, over the last week, participate in dissemination that's led to more than 2,000 registrants for this webinar tonight. So thank you to all of you who were able to help us with that. And I also, secondly, want to thank the U.S. Department of Education. We have forged a wonderfully collaborative relationship, and particularly over this past year, as we address the challenges of this pandemic, reopening schools, and engaging families as partners in supporting their child's academic success. And that's what this evening is all about. Next slide, Alice. Okay. Looks like we might have a little bit of technical difficulties with the visual. There we are. Thank you. So for those of you that don't know NAFSCI, you can see our mission and vision here. And I also want to just talk a little bit about our purpose. We are focused on presenting research and best practices to our broad constituency pertaining to families being effectively engaged in their child's education. That is what today's and tonight's virtual town hall is all about. You will hear from the experts within education and health around vaccinations for children. What this town hall is not, from NAFSCI's perspective, is a place to take political positions that are not related to this important information. The health of our children, from our perspective, transcends the political aisle. So I look forward to well-informed presentations, followed by questions and discussion from our stakeholders tonight. If you are currently not a member of NAFSCI, we encourage you to consider becoming a member, and you can get that information by just going on our website at nafsci.org. With that, I'd like to provide an overview of our agenda this evening. We will open with comments from our Deputy Secretary of Education, Cindy Martin, and we will then move to Dr. Rosalind Carter, who is epidemiologist and lead of the Vaccine Implementation and Evaluation section of the COVID-19 Vaccine Task Force at the U.S. Centers for Disease and Control, and she will present evidence behind the approval of the Pfizer-BioNTech age 5 to 11 vaccine. We will then follow with a presentation from Dr. Sonia O'Leary, the chairperson for the American Academy of Pediatrics, Council on School Health, and the medical director for school-based health services at the Denver Health Medical Center. And she will present why should we vaccinate children against COVID-19. And then we will follow that presentation by addressing questions from many of you through NAFSC's stakeholders, including Rosalia Grillier, NAFSC board member and a founding member of NAFSC's Parent and Family Leaders Council, and Dr. Sheila Jackson, a founding member of NAFSC as well, and the director of Family School Partnerships for Prince George's County Public Schools. I'll then provide a brief wrap up and then turn it over to Deputy Secretary Cindy Martin for her closing comments. Related to the platform, because there are so many people participating in this and we want to make sure that you get the information that you need, we are going to solely use the chat to provide links and resources throughout this presentation. There's also a Q&A, and we will use the Q&A. We ask you to use the Q&A to provide questions as throughout this presentation. We've already received 203 questions from many of you tonight, so thank you for that. And we've worked, our staff has worked to try to group these questions up. We certainly aren't going to get to everyone's questions tonight. We're going to do our very best, and then we will follow that up with an archive of this webinar, and then we'll include with that a variety of resources that are related to those questions. We'll do the very best we can to answer as many of them as we can. So with that, it is my great pleasure to introduce Deputy Secretary Cindy Martin, who will present a variety of information as it pertains to the U.S. Department of Education's work in addressing the vaccination issue. Deputy Secretary Martin.
Thank you so much for having me. Just a sound check. Can you let me know if you can hear me?
You sound great. Yes.
Great. Thank you so much. Just want to double check that tech is working. So good evening, everybody. Thank you. First of all, to our wonderful host for this evening, the National Association for Family, School, and Community Engagement. If we could be in clapping together, we would do that. You can clap and let everyone know that we're very thankful for our hosts. And thank you also to our partners at the Centers for Disease Control and Prevention and the American Association of Pediatrics, not only for joining us tonight, but thank you for your leadership and for your guidance to keep our schools open and our children safe throughout this pandemic. And thank you to all of you, over 1,500 parents from around the country. Thank you for joining us tonight to talk about the most important priority that's on all of our hearts and minds, our children's health and their uninterrupted education. All of us tonight on the call, parents, educators, health experts, policymakers, and communities must work together and work together closely and effectively to ensure that our children's health and safety is at the forefront. And the pediatric vaccines are a key tool in this fight against the virus. The vaccine availability for children ages 5 to 11 really did signal a turning point for us in the fight against COVID. It was bringing the most effective mitigation strategy to our elementary and middle schools, childcare centers, parks, and playgrounds that's had a profound impact on overall community health and safety. And vaccination for children ages 5 to 11, when you couple that with other layered mitigation strategies, that means peace of mind. Peace of mind during the holidays with family members who are seniors or immunocompromised. It means lowered likelihoods of illness in the classroom, quarantines, learning loss, and you all as parents having to figure out childcare or miss work. So since this pediatric vaccine was rolled out in November, I want to say nearly 1/5 of 5 to 11-year-olds and more than 5 million children have received their first doses. A recent report from the Kaiser Family Foundation shows that about half of parents of school-age children say their child's school provided information about how to get their child vaccinated for COVID-19, and more than 4 in 10 say their child's school encouraged parents to get their children vaccinated. And this very same report shows that parents of 5 to 11-year-olds whose schools encourage vaccination are actually 4 times as likely as those whose school did not encourage vaccination to say their younger child has already gotten COVID-19 vaccines. So we at the Department of Ed, along with the CDC and the health and science partners from across the government and the private sector and our partners in local schools, we're all committed to making vaccines and information about them easily accessible to you and to your children. If you haven't heard from your school or you would like to see your school get more involved in the facilitation of the vaccine, please do let us know. We are so happy to provide guidance and resources to make the process simple for all students and their families. Again, the administration is launching hundreds of new family vaccination clinics at community health centers and other trusted locations all around the country, and that's going to help further make vaccines available and convenient to access for you and for your whole family. We see this as one-stop shops that can offer vaccines for the whole family all at the same time and the same place. And parents will be able to get their first or second or booster shots and get their kids vaccinated all at once. I know we have a long way to go to ensure that every child is protected from this virus and able to access school where we know they learn best, inside the classroom, safely and consistently, and for your families to reach a version of normal that works for you. We're eager to be good partners with you, your schools, your communities, to make these vaccinations available and accessible to all children. And our partnership goes both ways. You all are trusted members in your own communities, so I encourage you to get involved in getting the word out about the vaccine to your family, your friends, your neighbors. They listen to you. And if you're interested in hosting a 5 to 11 school age based family-based clinic, work with one of the partners that are right here on this call to be connected to a local pharmacy partner to help with that great effort. Please share your stories with us. We want to know how to access the vaccine for your children is providing relief in your schedules, emotionally and logistically for you. And we want to know the types of questions you have or what you're hearing about the vaccine and its efficacy and its availability, and any hesitations that you might have. Share your questions and your concerns with us. I want to thank you again to all of you for joining us tonight. I want to leave you with a quote that I love from Mr. Rogers. If any of you remember Mr. Rogers, he said, "When I was a boy and I would see scary things in the news, my mother would say to me, look for the helpers. You'll always find people who are helping." The health officials on this call are our helpers in this fight, and they are here for you. So I encourage you to ask all the questions you may have of the CDC and AAP tonight, and the Department of Education. We're always here to help as well. I want to thank you again for your commitment, keeping our children and community safe and healthy, and know that we're all in this together. Thank you so much for letting me give some opening remarks today.
Thank you so much, Deputy Secretary Martin, for those remarks. I'd like to move now to a presentation from Dr. Rosalind Carter. Again, she is the epidemiologist and lead of the vaccine implementation and evaluation section of the COVID-19 Vaccine Task Force at the U.S. Centers for Disease and Control, and she will present evidence behind approval of the Pfizer-BioNTech age 5 to 11 vaccine. Dr. Carter.
Thank you so much, and I'm really thrilled to be here tonight speaking on behalf of CDC. Next. I just wanted to start this evening with telling you a little bit about the mRNA vaccines, of which Pfizer is one, Moderna is the other. The messenger RNA is delivered through the vaccination, and it instructs the cell's protein synthesis machinery to make the spike protein. And then that spike protein is displayed on the cell surface. So if you see the little red pieces on the diagram, that's the spike protein. So in the lymph node, B cells and T cells, which you see attached to those spike proteins on the diagram, they're going to develop an adaptive immune response. And it's this adaptive immune response that includes production of antibodies and development of T cell responses against that spike protein that result in immune memory. But at the end of this, the mRNA is then degraded and it never interacts, it never integrates into your cell's DNA, it never gets into your cells, period. That should answer a lot of questions. Next slide, please. Now I'm going to talk a little bit about the epidemiology of SARS-CoV-2 among children ages 5 to 11. Next slide. This is a graph of weekly COVID cases since the start of the pandemic. So there's 28 million children between 5 and 11 years old in the United States, and more than 2 million have gotten sick with COVID. And that's more than 2.6 million among our 12 to 17-year-old children. So while fewer children have been sick with COVID compared to adults, children can still be infected with the virus. And the most important point is that there's no way that we can tell in advance who's going to have a mild case of disease and who's going to have severe disease. Next slide. This graph, I'm pointing out the red arrow to the right of the slide. It's also a graph showing the weekly cases of COVID in the US. And most importantly, between the end of October and early November, there's been an increase in cases among the 5 to 11-year-olds. So that dotted yellow line represents that age group. And again, just to make the point that this is not over. Next slide. And finally, this demonstrates that out of all the cases of COVID from the start of pandemic till middle of October, if you look at those 3 blue lines on the bottom, those represent children 0 to 17. And children in that 5 to 17-year-old age group who are eligible for vaccines make up almost 20% of all of the COVID cases. And that number has only increased in recent weeks. Next slide. Finally, 94 children in that 5 to 11-year-old age group have died from COVID. While it's a much lower mortality rate compared to adults, we hope that we can reduce this number to 0 through vaccines. Next slide. So in summary, children are at least as likely to be infected with SARS-CoV-2 as adults. There's over 2 million reported cases in children. And when we've looked at immunity in children by what we call seroprevalence studies, about 38% of children in that 5 to 11-year-old age group in a study done in September were positive for SARS-CoV-2, meaning that they had already possibly had a mild case of illness. So children are at risk of severe illness from COVID. More than 8,300 children have been hospitalized. About a third of those required an ICU admission. We have some, again, very severe outcomes that Dr. O'Leary will talk more about. And then we have secondary transmission from children within schools to other children and within their households to other children, to adults, and also the elderly. We feel that a widespread use of an effective vaccine would reduce that public health burden of COVID-19 in children. Next slide. I'm going to switch gears now and talk a little bit about the clinical trials. Next slide. So it's very important to understand that the COVID-19 vaccines have undergone the most intensive safety monitoring in US history. We've conducted trials with thousands of children to evaluate safety and make sure that there's a good immune response that I'm going to describe now. And because children are still young, they're growing, they're developing, they also investigated whether children could also have a good immune response with a smaller dose, smaller than the dose for teens and adults. So how did the FDA and CDC decide to recommend the vaccine? We did the in-depth review of the data from the clinical trials. So about 2,200 children were followed for more than 3 months to look at how many children in the vaccinated group and how many children in the unvaccinated group got COVID. And they also looked at any side effects. And they concluded that the Pfizer vaccine is over 90% effective at preventing COVID in children 5 to 11. Next slide. So who were the children in these studies? So again, out of the 2,268 children, 79% of them were white, 6% were Black, 21% were Hispanic, and less than 1% were Alaskan Native, American Indian, or Pacific Islander. The mean age was about 8 years old, and 21% of them had a range of comorbidities, including asthma, diabetes, and obesity, and other cancers. Next slide. We next looked at serious adverse events, particularly among children who received the vaccine. So the most important point is no children died. There were no deaths among kids who took vaccine or those who didn't take the vaccine, and basically found no serious adverse events that were related to the vaccine. So in the first look at the data over 3.5 months, there was one serious adverse event in a person who had been vaccinated. That was a limb fracture, again, not related to vaccine. And adverse events in the placebo group, those who were unvaccinated, included pancreatitis and abdominal pain, again, not related to the vaccine. And the same was shown following up these children for an additional 2.5 weeks. Next slide. We next look at reactogenicity, and basically the children and their parents were asked to fill out electronic diaries for 7 days to record any symptoms following each of the 2 doses of vaccine. So local reactions were very, very common and occurred in 86% of vaccine recipients. The most common by far was pain at the injection site, or essentially a sore arm. Other systemic reactions occurred in about 67% of the vaccine recipients, and the most common were fatigue and headache. They also included things like body aches. But severe reactions, what we call a grade 3 reaction, although they were slightly more common in the vaccine recipients, overall were extremely rare. So again, these local reactions and reactions like fatigue and headache are really what we consider normal signs that your body is building protection, and they tend to go away within a few days. Next slide. Now I'm going to talk a little bit about an issue you may have heard about, which is myocarditis. So myocarditis is an inflammation of the heart muscle, and related, there's pericarditis, which is an inflammation of the lining outside of your heart. And in both cases, the body's immune system causes inflammation in response to sometimes an infection or sometimes to a trigger like a vaccine. And symptoms can include chest pain or shortness of breath. We've looked at this in 12 to 17-year-olds, and they tend to be more common in boys and more common after the second dose. What we observed, however, in the clinical trial is no cases of myocarditis in the 5 to 11-year-olds, studying over 2,000 children. So it's still considered a very rare event, but it's something that we're continuing to follow up children very closely, and it may occur again once we're looking at millions of children who've received vaccine. Next slide. So overall, when we are making a recommendation, we weigh the benefits against the risks. So the benefits of the vaccine are to prevent COVID-19 in children. It'll likely prevent hospitalizations, multi-system inflammatory disease, and other post-COVID conditions. Hopefully, it will possibly prevent transmission within families and within schools. And it will provide greater confidence in a safe return to school and social interactions. But there are still risks that we acknowledge. I just spoke about the potential for myocarditis or other rare events associated with mRNA vaccines, and the risk of the short-term reactogenicity, again, pain and injection site, the headache and fatigue. Next slide. But in summary, the balance of the benefits and risks were felt to be much more in favor of the benefits of this vaccine, which led to the recommendation. The clinical trial demonstrated the vaccine is safe, immunogenic, and effective in children 5 to 11. And again, we'll continue to look at all of these safety issues going forward through various systems that CDC has to look at the safety of vaccines overall. Next slide. I'm just going to talk a little bit about the vaccine itself. Next slide. So the vaccine for children 5 to 11 is new, and it's different formulation than what we give to teenagers 12 to 17 and also to adults. The dose for children is 10 micrograms, or a third of the concentration in what we give to adults. It's the exact same active ingredients, but a different vial color and a different vial altogether. It's a smaller dose, and we also use smaller needles for children. But similar to adults, it's going to take 2 doses to be fully vaccinated, and those 2 doses are given about 3 weeks apart. And right now, we don't know anything about whether or not a booster dose would be needed at a later time. So consider fully vaccinated after 2 doses. Next slide. So I think Dr. Martin did a good job in describing how we're trying to reach children. Again, make it accessible to all. We want all children to be vaccinated. We do know that for most parents, the most trusted source of health information is their pediatrician. And so the vaccine is, we've tried to make it available in all pediatricians' offices, family practice offices, as well as health departments, FQHCs, and rural health clinics. You can also get the vaccine at many pharmacies, just like the adult vaccine. And while you're there, please get your flu vaccine at the same time. You can get both vaccines at the same time, and so can your children. And as Dr. Martin described, many schools are successfully partnering with pharmacies and local health departments to offer it at the school and run school vaccination clinics. Next slide. And finally, just to acknowledge that children's hospitals across the US are offering it, as well as temporary community clinics in your neighborhood, health departments partnering with churches, with YMCAs, Jack and Jill's, and other community centers to make the vaccine, again, as convenient to get as possible. Next slide. So since the beginning of the pandemic and among US children 5 to 11, there are 2 million cases, 8,300 hospitalizations, over 2,000 cases of multi-system inflammatory disease, 94 deaths. But now we know that COVID-19 is a vaccine preventable disease. Next slide. Next slide. So just a quick peek at how we've done so far. This map just shows the vaccine coverage by different states. And we see the East Coast, West Coast, Northern US, and a little bit of the West are doing well. Other states are still trying to catch up. But 15% of children 5 to 11 have now received their first dose, which is, next slide, about 4.3 million first doses, and an additional 1 million children have received their second dose of vaccine, which is just enormously rapid progress in just 4 weeks since the vaccine was approved. Next slide. So if I could just close by saying, as Dr. Martin said, let's protect everyone and all of their families. You have really an important role as a vaccine ambassador. In addition to schools that encourage vaccinations having a very strong role in increasing vaccination rates, the single strongest predictor of children getting vaccinated is whether or not their parents are vaccinated. So please do your part. If you have questions about the vaccine for yourself or for your child, please talk to your healthcare provider and other people that you trust to talk about vaccines. And just one more. Next slide. Just some breaking news from CDC. If you know of 16 and 17-year-olds who were vaccinated this summer, anyone vaccinated between April and June of this year is now eligible for a booster vaccine. So this is brand new booster recommendations for 16 and 17-year-olds. Please help us spread the word. And then next slide, finally, just leaving you with a few resources from CDC to help in this efforts. And I thank you so much for the opportunity to speak tonight and look forward to your questions. Thanks.
Thank you so much, Dr. Carter. And we will, those links, we'll make sure that they're not only provided in the chat, but we'll also make sure that we're providing them as links connected to our archived recording that will be provided sometime next week. I also want to just thank you for providing such detailed information and clarity. That was really helpful. Next, I'd like to move to Dr. Sonia O'Leary. Dr. O'Leary is the chairperson for the American Academy of Pediatrics Council on School Health and the medical director for school-based health services at the Denver Health Medical Center. And she is going to present the why around consideration of vaccination for children against COVID-19. Dr. O'Leary.
Good evening, everybody. Thank you for having me here. I just wanted to introduce myself a little bit more in that my name is actually Sonha O'Leary because I was born in Bogota, Colombia. And so my mother pronounces it like a Spanish J. I am a general pediatrician and I've worked in Denver and I've seen kids from 0 to 21, sometimes 25 for over 20 years. And for the last 9 years, I've been the medical director of pediatric clinics inside public schools, which is a really fun concept. And I would like to also tell everybody that our team, our school-based team, has done over 32 vaccine clinics inside schools and have vaccinated over 5,000 children and their families for COVID-19. Next slide. So the AAP recommends COVID-19 vaccination for all children and adolescents 5 years of age and older. And so I wanted to let you guys all know that there are basically 28 million children now also eligible to receive the vaccine. And we know that it is 90% effective in preventing COVID-19 in children ages 5 to 11. The vaccines have actually undergone some of the most intensive safety monitoring that we've ever had in US history. And in the clinical trials, I know there were these questions in the chat, that there were over 3,000 children who were 5 to 11 who were in part of that trial, some of them actually the children of some of my friends. And there were not any serious side effects. And most of the side effects were the same ones that you sometimes see in adults. This slide talks about contraindications. What would be reasons to not vaccinate someone against COVID-19? There's really only two. And they are either a previous allergy to COVID vaccination, which means when your first dose, you had a very severe allergic reaction. The second dose is actually having an allergy to the components inside the vaccine, but that's actually really, really rare. Next slide. So why should we vaccinate our children? There's basically three answers to this. One is to keep kids safe. 2 is to keep family members safe, and 3 is to keep our community safe. So remember that children make up over 22% of our US population, which is 72.8 million little people. And over 7 million children have been infected with COVID-19. A large portion of them have been hospitalized, and that's currently going on right now, especially with all the other infectious diseases that we're seeing as well. And 651 have died of COVID. I personally have had patients who have died who are teenagers of COVID infection. The one that I remember the most is the teenager who died 1 month after her grandmother died. And that was devastating for that family. The other reason is that there is this risk of heart inflammation, myocarditis, and patients with COVID-2 infection are almost 20 times higher, have a higher risk for myocarditis compared to children without SARS-CoV-2. I will say that, yes, we do know as stated before, that the vaccine can actually give you sort of a mild form of myocarditis. It is very short-lived. None of those children have had any other issues once 2 days had passed. And finally, kids, when they get the natural COVID infection, can get this terrible illness called multi-inflammatory syndrome for children, which is basically a syndrome where they end up having to be hospitalized and getting tons of different medication to really calm down that infection. We know for sure that the vaccines for children are effective against the previous strains of COVID. So the Delta one, especially that one that's so contagious, but we're hoping that it is also good against the Omicron variant. There are still studies being worked on right now to figure that out. Next slide. I also want to remind people that, COVID-19 doesn't just affect children from a medical standpoint. It actually affects their mental health. You all know that there has been a mental health crisis that has been actually announced. this past semester, we have seen so many more children with anxiety and depression and needing mental health help. The mental health therapists who work within my school-based health center are just so full, and it's so hard right now because everybody, when you screen them for the risk of anxiety and depression, they come back positive. The second thing is that I think an impact that has not been talked about a lot is the death of a family member, parent, grandparent, aunt, uncle, cousin to COVID. It's actually around 167,000 children in the US have experienced the death of someone close to them. And we know that this is higher among children with racial and ethnic minorities compared to non-Hispanic white children. We also will say that racial and ethnic minorities account for about 65% of those who have lost a primary caregiver due to the pandemic. The last one that we've seen, and we're seeing the repercussions of that right now, are increased. There has definitely been an increased incidence of child maltreatment, which means children getting punched or sexual abuse or other things. And we're actually seeing the effects of that right now. The last one that I'll say is the educational effects. We have seen a decreased amount of children being enrolled in public schools. We also know that our kids aren't where they should be in terms of where they should be for math, where they should be for English. So all these effects just because of COVID-19 pandemic. Next slide. So I know that this was in the chat as well. What are the vaccine side effects? In my honest opinion, for all the children that I have vaccinated in the last 6 months, the biggest one is a sore arm, redness, tiredness, fever, chills, headaches, and just some stiffness. Just the same effects that adults have. I will say that the 5 to 11 dose, because it is a little bit smaller, has definitely had less effects than the vaccine for 12 plus. These are all temporary. They last a couple of days. Sometimes they can be worse after their second dose, and we're getting that information right now, right? Because the majority of children were eligible for their second dose just this past week or the week before. So to say again, I would say that remember that 3,100 children from 5 to 11 received the vaccine. The clinical trials did not exclude medical conditions. I know that was a question that was out there. Did it say that kids had to be healthy to have the vaccine? That is incorrect. The only people who were excluded that were not in the clinical trials were anyone who was immunocompromised, specifically children undergoing chemotherapy for cancer treatment. I think the point of 4.3 million children having been vaccinated already is huge, because 4.3 million children have shown that it is safe in all medical conditions, meaning heart conditions, autism, anything else. Like I said, there are still studies trying to figure out what the right dose is and what the booster doses should be for kids 5 to 11 who are immunocompromised. But at this point, I, as a pediatrician and as a scientist, absolutely recommend this vaccine to all my patients. Next slide. So why is the COVID-19 vaccine important for schools? Well, one, because I think what we have seen from this pandemic is that schools and school-supported programs are essential for our children and for our adolescents, because they don't only provide education, they provide food, they provide mental health, they provide important development activities that they need, friends, social activities. So for all those things, we need to keep our schools open, and getting the COVID vaccine will make that happen. Keeping schools open is crucial to prevent the demonstrated loss of learning that has resulted from the pandemic. And then finally, they're an important part of the multi-pronged, layered approach to protecting students. I kind of think of it as like an egg with a shell, but then you keep putting shells on it. The vaccine is such an important part of that shell to protect the kids from getting COVID, but that also includes mask use, physical distancing, ventilation, frequent testing, and hand washing. And I know that the testing part is not always accessible. It's not always easy for people to get their kids tested, especially right now. I will also say that it's going to be an important part of hopefully decreasing quarantine that happens because of being exposed to someone with COVID-19. In our school system, there were two basketball teams. The entire teams were quarantined because the majority of the kids were not fully vaccinated. And also, hopefully, to decrease mask mandates in the future. I know we all hate masks. I hate them too, but I realize how important they are. And wouldn't it be great for kids to go to school without masks at this point? Next slide. So in terms of preparing your child for vaccination, I think that's a hard one because most kids have had tons of vaccines by the time they're 5 to 11 years old, right? So they get them at 2, 4, 6 months, a year, 2 years, 4, and most kids get their annual flu shot as well. So the kids kind of know what's going on with this. I sometimes feel like it's the parents who are more worried than anything else. What kids have told me is that they're so excited to get vaccinated, to see their grandparents, to go on vacation. Older kids are happy to not have to keep testing and to be able to play sports. And I will say that the best thing that works is distraction techniques. And also sometimes you just need a good hug to make sure that you don't move and get your vaccine. Next slide. I think this is the most important slide in the terms of what are the biggest issues with vaccination. And I think what they are right now are access or hesitancy. So what is access? Access is being able to get your vaccine at the clinics where you normally get your pediatric care. And I know tons of pediatric practices and family practices have tried to get authorization to be able to provide COVID vaccine in their clinics. Access to good information. Who gives you the good information? I'm going to tell you right now, it's not TikTok, it's not Facebook, it's not Snapchat. It is your pediatric provider and the CDC and the AAP. And finally, back to access to trusted experts to ask questions. That's why we're here. We want you to ask us questions, and we're going to give you the most honest answers that we can come up with. My children are vaccinated against the COVID-19, and I absolutely try to convince every single one of my parents and the kids that I see for well child checks to get vaccinated as well. So hesitancy, what does that mean? So those are strongly held beliefs which include from friends, family, or community members against vaccination. I'm just going to tell you a couple of the ones that I've heard. The funniest one, but maybe it's not funny to some people, is 12 and 13-year-olds worried that they're going to become zombies. The second one is the magnet. I know you've all heard about the magnet. Fertility, tons of questions about how this is going to affect my daughter's fertility in the future. And finally, the biggest one is what's going to happen in the future? Is this going to change my child's DNA? And I guess that goes back to the zombie question. I think one of the important things for you guys to know is that there is no vaccine that has long-term consequences. If there is a side effect from a vaccine, you'll know it within minutes or days. None of them last longer than a couple of days or weeks. And so I just want to make sure you guys know that, as well as that mRNA technology, that cool technology that we've had for the last 10, 15 years, it goes away after it's been put into your body. And I sometimes wonder if people really understand that, especially because of all of the misinformation. So the wrong information that's out there. Next slide. Some great places to get good information is healthychildren.org. It's also aap.org, especially if you have specific questions. Other parents have those same questions. Look on these websites. These are good websites. Next slide. Some other places that are great, the American Academy of Pediatrics, or the AAP, has a YouTube channel, as well as a COVID-19 toolkit for all the medical providers out there, and some great YouTube videos on what is an mRNA vaccine and how does it work. Next slide. And finally, the president of the American Academy of Pediatrics, Dr. Lee Beers, has this great YouTube video that's on the White House YouTube channel on kids actually asking her their questions for vaccination. It is fantastic, and I would definitely ask you to take a look at it. Next slide. Thank you for letting me be here, and I look forward to your questions.
Thank you so much, Dr. O'Leary, for your presentation. We'd like to move, we have about 10 minutes, which is not enough time, but again, we will follow up with questions in the archive and provide a variety of resources, answers to those questions. So what I'd like to do is I'd like to ask our panelists, that would be Dr. O'Leary, Dr. Carter, I believe Precious McKesson, and is that everyone? And then I'd also like to ask Rosalia Grillier and Dr. Sheila Jackson to turn on their cameras. And we're going to turn it to them. Again, Rosalia Grillier is a NAFSCI board member and a founding member of NAFSCI's Parent and Family Leaders Council. And Dr. Sheila Jackson is a founding member of NAFSCI and the Director of Family School Partnerships for Prince George's County Public Schools. And they are going to moderate questions. Rosalia will be addressing the questions that were already sent from, I think, the 203 questions from those who registered, and Dr. Jackson will address some of the questions and ask some of the panelists to answer some of the questions that were presented this evening. Rosalia and Dr. Jackson.
Thank you all so much. And thank you everyone that joined the webinar this evening. I'm especially excited about the panel that you just heard from, because they're making my job easy tonight, because they've basically addressed most of the questions that you guys sent in. However, I do want to lift up a couple of other questions that a number of parents asked around whether or not there will be mandates in schools, and especially in Head Start and childcare. And are there any exemptions that have been discussed or put in place? And any other panel can feel free to answer that.
I'll take that for you. Thank you so much for the opportunity to speak again. My name is Precious McKesson with the Department of Education. Coming from the Department of Education, we're not seeing any of those mandates. We just want to make sure that everybody continues to follow their local, state, and recommendations from their health departments. So that information will come from your local. It would not come from us at this time. So just continue to follow the mandates or wherever instructions that your state, local officials are given.
Sheila, are there any questions on your end?
I do have some. Thank you for asking. And again, thank you for having me. One of the questions that we received, and it's from Ashley and Monica, have asked about whether we have an idea of when a vaccine might be available for children under 5 years old.
I'll take that question. We are actively planning for that event. We expect that the drug manufacturer submits all of their information to the FDA to begin the process of review. So we expect that that'll happen sometime early in 2022.
Thank
So
you.
Should not be too much longer, but not right away.
Okay. Thank you. Another question is, should children who have already had COVID-19 get vaccinated?
I can take that one. Absolutely. Because even though COVID-19 does give you antibodies, a better layer, like if you think about the layers again in the egg, is to actually get the vaccine as well, so that your child can be most protected against any COVID-19, and especially variants that we don't know are going to happen.
Thank you. Back to you, Rosalia.
Thank you so much. I do have a question from April, and she's wondering, since COVID has been transmitted regardless of whether or not folks had vaccines, should the quarantine status, should there be any differences in quarantine status?
Yeah, so I can take that one as well. I agree that right now with the high amount of COVID that we have, it is getting transmitted even with people who are vaccinated. There's modifications to the quarantine status if you are fully vaccinated. So in kids, for example, if they're fully vaccinated, most of them can and have been wearing masks. That's the biggest thing. They can actually stay in school. until they get sick or until they get tested to make sure that they're okay. So great question. But it does actually change your quarantine status a little bit if you've been vaccinated, or a lot actually.
Sheila?
Sure. We've received many questions on whether the vaccine was tested on or whether there's data on how the vaccine affects children who are immunocompromised or that have other health conditions such as asthma and autism. In the sample, was there any data about children who have immunocompromised positions?
So I guess I'll take that question first. So I think, as I mentioned, 20% of the children in that trial did have underlying health conditions, such as the ones that you mentioned. The numbers were too small to separate out if children with diabetes or asthma had particular reactions. But I think what we saw overall is that there were no serious adverse events associated with the vaccine, and those rates were the same as children who are unvaccinated. So we can conclude that children with those underlying health conditions, that there's no additional risk associated with taking the vaccine. It won't make those conditions worse.
Thank you.
Dr. O'Leary, do you want to comment as well?
No, I agree with that. And also to remind everybody that at this point, 4.3 million kids have been vaccinated. So that's going to include kids with medical conditions. And so just remembering that also is pretty important.
Thank you so much. I know you guys touched on this a little bit, but Kimmy wanted to know, how does the vaccine differ from the common flu shot or other styles of vaccines?
Dr. Carter, I'll let you take this one.
Oh, it's a little hard to answer. Each vaccine is different and the technologies of each vaccine is different. So sometimes we have live vaccines, sometimes we take a virus and we inactivate it before we put it in a vaccine. So this particular COVID vaccine is based on the new mRNA technology, which wasn't available for flu, wouldn't be appropriate for flu. So I think we're continuing to keep up with science. I hope that answers the question.
Thank you so much.
And then we have a question. Will there eventually be a booster needed for this age group?
You know, that's a great question. It's unclear right now because it seems like the kids, when they get their vaccine, they get great levels of antibodies. And so is it necessary? I don't think anyone's super clear about it. Sorry, my dog is whining in the background because he wants to be let out. So I'm sorry about that. But I think, time will tell. I do know though, for kids over 12, if you're immunocompromised, you should get that third dose. I think we'll see what happens with the 5 to 11 group.
Thank you.
Dr. Jackson, Rosalia, any other, is there time for, I think we have time for one more question, if you have one. Otherwise, we can move to closing remarks.
Well, you guys did share some resources, but what are some of the ways that we can keep parents informed on an ongoing basis of new developments or any other information that they should have on the ground to continue to diffuse any misinformation or misconceptions?
I love that question. I think if folks are on Twitter, get on the American Academy of Pediatrics or the CDC Twitter accounts. Same with Facebook. They also have accounts in other social media, but those are great ways to get actual good scientific information. Dr. Carter, what else would you suggest?
No, I agree. I think a lot of the community-based organizations, near you also do a good job at getting the word out, holding events, using a variety of mediums to get good information out, using the arts, and then disseminating it through, again, churches and other religious organizations. Schools are doing a great job in providing that education. And then there's so much downloadable material, again, from American Academy of Pediatrics, CDC, Department of Education, Made to Save, the HHS website. So the information is certainly out there. And as soon as anything changes, we push the new information out there as soon as possible. So you'll see media briefings and with wide sort of press coverage. So I think just keeping informed is not too difficult, but there certainly is a lot of misinformation out there. So I think that's where we rely on you, our parents and schools, as trusted partners to make sure that you carefully look at the sources of information, and if rumors are going around, then take the time to, understand them, address them, and deal with the misinformation. So thank you for doing that part.
Thank you to our panels. Thank you, Rosalia and Dr. Jackson, for your participation this evening. I'd like to just provide some thank yous and then move for closing comments to Deputy Secretary Martin. First, I want to thank our NAFSC team. They made this happen in a week, and really appreciate all the work that went into this event tonight. So thank you to everyone on our NAFSC team. I want to thank the U.S. Department of Education. We really appreciate this department and their commitment to family, school, and community engagement, and we appreciate our relationship as we continue to advance this important work. I want to thank our partners who enabled us to be able to get 2,000 registrants who will see this, not only those who were on live tonight, but those who will receive it early next week so that they can get this important information. And then finally, I want to thank our audience, thank all of you, our members and stakeholders. On behalf of NAFSC's board and staff, we wish each of you and your families a happy holiday season. And with that, I'll turn it over to Deputy Secretary Martin.
Thank you so very much. How inspiring to just hear the active participation, the voices, the questions, the curiosity. I agree, Rosalia, you all were amazing. And Rosalia, I think I'm saying your name correctly. Thank you for what you do. You're a trusted resource in the community, and you're modeling how we come together around tough topics that we don't always have the right answers to, or it can be confusing, but to have one straight path forward and bring the experts together. This organization's done a tremendous job bringing everyone together. Somebody did tell me when I was giving my comments, you somehow couldn't see my camera. I don't know why it went off, but here I am. If you couldn't see me before, and I'm just so grateful of what you're doing. I'll reiterate what I said, that at the Department of Ed, we are very eager to be good partners with you. We have a long way to go. There's so much that we still need to do, and to ensure that every child's protected from this virus and able to access it. Schools can play such an important part, but so can the trusted partners and resources that you're turning to, good, reliable sources of information, to make sure that people have the facts that they need, and to make sure that families are getting everything that they need. We at the Department of Education see ourselves as a service agency, and we have equity at the forefront of everything that we do. And when we define equity, we say it means each and every student and their family gets what they need, when they need it, in the way that they need it. And that's in an educational context about learning, but it's absolutely true for the vaccine. We want to ensure that each and every student and their family and the community that they live in has what we know to be the best safeguard to this pandemic being able to move forward. So if you're, like I said before, if you're interested in hosting a school-based site, we can partner with you and we can hook you up to resources if they're not available. We have team members from the Department of Ed on this call right now, so we can follow up with anybody that has outstanding questions about clinics. I think I saw one in Ohio, you had a question, so we'll circle back with you on all that. And just thank you to the healthcare professionals, to the educators, to the parents. Everybody's doing this work together. And a lot of times people say we're all in this together. We have to lean in and support one another. We've all been in it for a long time, and we like to say sometimes we're all in it together, and it's not necessarily the same, maybe the same storm, but we're not all in the same boat because everybody has experienced this and the impacts very differently. And it's our job as a community to come together and make sure people have what they need when they need it in the way that they need it. And vaccines are a great path forward for that. Thank you to the medical professionals that put true facts out there for us today. And thank you to this organization for pulling this together. True leadership is marked by events like this. And I can't say enough thanks to the National Association for Family, School, and Community Engagement and your executive director. You've done a great job pulling this together. And thanks for allowing us to have an opportunity to address your wonderful audience this evening.
It's our pleasure, Deputy Secretary. Thank you. Happy holidays to all of you and good night.